Dear participants, we will start the session in a couple of minutes. 2-3 minutes, we will start the session.
Abhishek, I'm just joining. Please.
Okay, thank you, sir. So, shall we start?
Just a minute. Just a minute.
Okay, okay.
जी नहीं पता है क्या वो तो देखिए तभी तो आप एक्चुअली में आपको फोन करने का कारण ही यही है ना कि आप तो yeah good morning and very sorry actually there was a telephone call and I was not able to like come join further. Please. Sorry, Doctor.
No problem, sir. No problem. So, good morning, participants. So, we have our expert, Dr. Neelesh Kumar. He will be delivering a lecture. So, first, I would like to introduce him. Dr. Neelesh Kumar is presently working as Chief Scientist and Head in the Biomedical Instrumentation Group of CSIR Central Scientific Insurance Organization Chandigarh with 24 years of R&D experience since 2001. He is also head of Mechatronics Electronics at CSIO Indosys Training Center Chandigarh. He has completed ME Instrumentation and Control in 2005 and MBA Human Resource Management in 2006 and PhD in Gait Analysis for Prosthetic Biomechanics in 2012. He has an interest in IPR and Technology Management, thus completed PGDIPR and PGDIVO. He worked on 27 projects of national importance like Jal Vigyan, Linear Accelerator, Functional Electrical Stimulation System for Paraplaglsis, Electronics Portal Imaging System, Electronic Knee Joint, Exoskeleton Devices, Robotic Device for Gait Rehabilitation and Virtual Rehabilitation. He was instrumental in setting up a gait motion analysis lab in 2008 and cognitive and virtual rehabilitation in 2016 in CSIR-CSIO and involved in experimental biomechanics. His area of interest are techniques of gait assessment, sensor development, design and development of assistive devices, and methods to quantify rehabilitation. He is serving in the application of prosthetic biomechanics for the development of robotic rehabilitation devices. He has received national awards for the development of technological aids for the mobility of the disabled in 2012-2019 and the IEI Young Engineers Award in Electronics and Telecommunication Engineering discipline for the year 2009. IET BV Valega Memorial Award 2018, ISTE Best MTech Thesis Award, INSA Bilateral Fellowship 2018, and Raman Research Fellowship 2013. He has filed 7 patents, 8 copyrights, 3 design rights, 75 journal publications, 70 conference publications, and guided 9 PhD students. Delivered 51 expert lectures and 9 technology commercialized in his credit. So with this introduction, I invite Dr. Neelesh Kumar to deliver an expert lecture. Over to you, sir.
Yeah. Thank you, Dr. Abhishek, for your kind words. And again, I welcome all the participants to this workshop and in online mode. And I welcome on the behalf of organization and Department of Biomedical. So, Sakshi, madam.
I
Yeah,
muted you.
thank you very much. Okay.
Okay.
So as Dr. Abhishek has mentioned, so I have a certain year of experience in developing medical devices. In particular, I have expertise in developing assistive medical devices, like the devices which are required by the physically impaired individuals. So mostly my work is confined towards spinal cord injury and congenital hemiparesis, where the neuromotor disorders are of a bigger concern. So I'll be sharing some thoughts on it, and I hope to have an interactive session, although it's an online mode. So if you have any question or any uh, thing to discuss, most welcome, and you can just raise your hand, and then we can have that interaction happen. So I'll start my slides presentation, PowerPoint presentation. So my slide is visible, Dr. Abhishek, the first slide.
Yes, sir. You can do it
Okay.
in presentation mode.
Yeah. So now I'll go in the full screen mode. So now hope the screen is okay.
Right. Yes, sir.
Okay, fair enough. So as the title says that the automation in healthcare. So you know that earlier the medical industry, the devices were not interconnected, the processes were in isolation, and although the process control was there, it was initiated long ago. But most of the medical processes are still subject oriented or the clinician oriented. Now there is an era where the automation is happening. The devices are talking to each other. The surgeons, what they are doing, what are their analysis is being shared, although made in the domain of imaging, to which the workshop focuses, or may this into the domain of biosignal analysis, where the different bioparameters are taken care, and the use of AI and other algorithms really give the clinical decision assist. So the automation here refers to the use of technology, particularly software and some hardware, to perform the task with minimal human intervention. So if I talk of clinical chemistry analyzers, earlier the analyzers were manually, we have to uh, add the dilate and the other reagents manually. But now the clinical chemistry analyzers are being converted into an automatic batch chemistry analyzers, where instead of doing a single subject reading, a batch can be performed. The mixing and getting the results is the process is the whole process is automated. So how it happens? It happens with the amalgamation of some software. The software which we call as an embedded software, or the software required to run that particular hardware, and then mechanical arrangement which we call as a machine. And just to apprise you, CSIO has a very strong presence in the area of clinical chemistry analyzers, and we have worked on clinical chemistry analyzers to batch chemistry analyzers and to automatic batch chemistry analyzers. So and again, we have transferred those technology. And people who are from PGI to this workshop, they know this collaboration because we work very closely with hospitals like PGI. MER is a very good partner to us. And what are the advantages? With the help of automation, healthcare delivery and the patient outcome or the processes are uniform and it is happening across the globe. So whatever the standard routine treatment protocol, it can be applied to the globe patients. The another very much requirement is to mitigate the human error or the subjectivity in delivering the healthcare or the treatment modalities. And it enhances the overall efficiency. So in short, it improves the efficiency, reduces error, lowers the cost, and ease the burden on the healthcare professional. And so they can focus on the more patients or simultaneously they can take care of many patients. Few of the other branches where the automation is happen. One automation is happen in the delivery side. The another automation is happening in the administrative automation. Again applies to the healthcare delivery part, but where the medical patient identification is unique, the recording of that particular data is happening, the EHR management again is happening, and the electronic health record can be shared with doctors throughout the country, and the second opinion, like having the second opinion or the second diagnosis is very much possible, and it reduces the as I mentioned that the clinical automation to which the workshop again very much focuses is to develop the diagnostic tools. So CSIO has some presence in analyzing the X-ray images or to convert 2D images into 3D images and to have the better diagnostic tools. So for example, detecting tumors or doing the diabetic retinopathy or the other modalities. So these can be at diagnosis. So this is the clinical automation part. The one example is robotic surgery, and nowadays it is a very common word to have a minimal invasive surgery system in hospitals where the robot performs a surgery. But the catch here is the robot acts here as in slave mode. The surgeon is still doing the surgery, but it is the surgeon is not acting upon the patient, but it is the surgeon is sitting on a console and then performing the surgery. Remote monitoring, use of wearables. We all nowadays uses smart watches, although they are not very clinically significant these days, but still some initial indicators are there depending on indicating your sleep pattern, your number of steps taken. And these devices are interconnected to your other devices. So they are connected to IoT devices and they collect the patient data. For them, a healthy individual is also a patient if he's not doing an exercise or he's not sleeping well in time or the sleep patterns are disturbed. So then it can alert the physician for different abnormalities and it can also generate flags, which we say as an lifestyle disorders. So this is a very new and very good area where the automation is happening. So these are another examples. I'll focus mostly on the last one where the patient interaction and support. So as you know that the cases of mental subjects requiring mental health are increasing in the country. And there are some estimates which are alarming that we are going to be the mental health is will surpass the cardiac disorders and the other disorders, and it will become the heaviest disease burden on the country. So in this, there are some chatbots or virtual assistants. They are being developed using some 24/7 helplines. And then they talk to the affected individual and then they try to give them different opinions, the different health supports. So this is another area where the automation in healthcare is happening. The telemedicine platform, which we have very much used during COVID. So like to perform the patient check-ins, documentation, follow-ups, and again to share the medical data and to have different opinions. And with the advent of this COVID thing, there are some technologies which really accelerated, and telemedicine is among one of them. It started in somewhere in around 2004, but because of the infrastructure limitations, the technology was not able to fly. But now the infrastructure is available. The villages are well connected to a very high speed internet, which is a very essential component to this. And again, doctors are now very much okay with this concept, and they are using these platforms to provide the patient care. So the benefits are, as we said, that it will improve the cost efficiency, the patient safety will enhance, uniform treatment modalities will happen, and it will also elevate the staff workload. So this is some data which says that automation in healthcare is required because of the number of doctors available to the Indian population. If we take the ratio, then it says that there is one doctor on some thousand odd people. 836 is there. Again, it's an data. And in rural areas, it's again the figures are really alarming. So the automation is also helping in that. Uh, yeah, there are because when we give treatment, there are some eventualities which happen during the treatments, and that has been reported. And it may we may conclude in the sense that because of the lack of automation or the automation that is not connected, there are few incidences which happens. Like there was an ICU oxygen crisis at hospital in Gulbarga, and with no backup of power. So these are again the mostly the infrastructural requirement that is required to make a robust automation system. And it is not happening only in the developing or the underdeveloped countries, but a hospital in Israel also saw that the some 120 odd patients are exposed to wrong medications due to a software malfunction. So again, when you try to automate, so these are again the risk of the technology which we need to understand and which we need to take care of it after my lecture. So the workshop focuses on use of AI for diagnostics. So the term is called precision diagnostics, AI and lab automation. So as we were saying that there were the process of like doing a single sample, and then the batch of sample is happening. And now the machines are there which can automatically lab test the whole batch. And the throughput is also more, and the human error is also less. So this ensure the system, and again, if you use the AI bundle to it, so it can also generate initial diagnosis and which will help ultimately the clinicians. This is one very good example. This is very one good example of a CSIO developed technology, and Dr. Abhishek has contributed a lot on this, and he has a very active role in this. I'm just sharing his work with due recognition to him. That CSIO has developed a software that is called AutoSef, where the software can be used as an software as service mode. So the software is now being hosted as a tool on a CSIO server, and doctors in the world can download it, use the software, or what they can do is they can just upload their images, get the analysis done. So the software is for the cephalometric analysis. The cephalometry is a process where by which we can automate the landmark marking, and it helps in the dental reconstruction and the other to fix the other dental abnormalities. And again, to apprise the audience, this software has been worked or developed with a very close collaboration with PGI MER and AIMS New Delhi. So PGI is very significantly contributing in this. So when we talk of a software-based analysis, so then the feature addition and the feature enhancement is very easy. And the user requirement, user means the clinician requirement can be really added once the draft structure or the framework is ready. So this software, after being years of development, now have 17 lateral analysis, 3 posterior anterior analysis, and the automatic curve tracing. So these are different features which are available in the software, and now it can be used as an software as a service. One more example of automation where CSIO has transferred the technology. So in the earlier example, the software is available as a software as service model. So the user can upload the images, get the analysis done, and then they acknowledge. Right now, I'm not very sure that we are charging them, but yes, the per image analysis charge is a model, business model on which we can work, and again, we can use that to support the development. Here, the second development on which the CSIO has worked and transferred the technology is the slide scanning, automating the slide scanning method. So those who are in the biochemistry and the microbial and those sort of analysis, they know that to analyze, manual analyze a slide is a very tiresome and tedious process. And if you have a number of slides, then the process again requires expertise and many man hours. So here the system, it's an XY gantry based system. So it's basically, if you have seen the robotic printers, sorry, the 3D printers, which are robotic in fashion, there are drives, the X-ray, X and Y drives are there. So the slides are placed on a slide scanner, and then the whole slide like generates images, and those images are being stitched. And with the help of image analysis, the pathologist can have an initial assessment, and then he can himself can verify, okay, with this particular region is having those malignancy or inflammation or disease progression that's happening or not. So this is one example where CSIO has developed a very small hardware and embedded software. And now this application has been transferred to industry, and it's a Hyderabad based industry, and they are now making this technology available in the Indian market. This is one example, the surgical robots where CSIO has worked. CSIO has developed the different modules. So when we talk of a surgical robot, if you just try to imagine what will be required, you require a mechanical structure, although it will be much easier to explain here. So when you talk of a surgical robot, so what are the different components? The first component is a surgical arm, which is actually a surgeon's arm, which like doing the surgery and which taking care of the different maneuverability which is required. And as you know, we have two arms, but there are different surgical requirements which we need to have other associated arms also. So there is a vision arm, there is another arm that is called a tissue handling arm, and there are two arms which are surgical arms and which is required for suturing and the other surgical applications. The another component is called surgeon console, where the surgeon is sitting and the robot, the surgical arm, all the combination of these surgical arms forms a robot, and the surgeon is like maneuvering the robot. What action he is doing, the robot is replicating that particular action, and he is seeing his movement. He is like feeling the tissue density or the tissue, the haptic feedback is available to the surgeon, and he's seeing all that in real time. But the only difference is he is not acting directly on the patient, but he's doing the whole surgery on that surgeon console. So here the image analysis plays an important role, because when the tool is inside the body, there are a lot of issues of like getting the fog on the camera lenses, or getting the other fluids stick to the this your vision arm. So image analysis or the image enhancement in that particular section is very much required, and that the 2D image is also required for the other assistants who are like present in that surgical environment where the surgery is happening, for their reference, their understanding, and they are really assisting that particular surgeon in this case. And they are also changing the surgical tools, because the same the suturing tool is not able to give a cut. So again, they are changing the tools in real time. So this is a concept on which CSIO work. So what are the advantages? As you all know, the with a keyhole surgery or a robot assisted surgery, the blood loss is minimum or less. And when the blood loss is minimum, the recovery of the patient will be faster. There will be less pain because of the cut size is low, and the risk of infection will also be less. Since these processes are robotic controlled, the algorithm are well well validated in different scenarios where the error can happen. So they provide the greater precision in surgical techniques, but it requires special surgical skills. Every surgeon cannot like perform the minimal invasive surgery. So then the surgeon has to have special training. They are called minimal invasive surgeons, and they are very few like, because these methods are being evolved. So CSIU has worked, developed all different components, and we have proved the feasibility of this development, that this is possible, and we do have some patents on surgical arm and that other cases. So this area is rehabilitation, and you have seen that the how the wheelchair technology has been evolving. Earlier, the wheelchair, if you just so it's a mechanical arrangement where the subject is sitting and he's using his own muscle power to like make the wheelchair move or doing the maneuvering. But with because of the different impairments, sometimes the subject is not able to really maneuver the wheelchair, and he's just requiring another assistance to like do this. But the automation is really helping in these scenarios. They are understanding the patient requirement. One more thing I want to emphasize here is, when we talk of a uh, physical impairment, the adaptability is a very big question. The adaptability of the technology to that particular scenario is very much required, because every impaired subject is different. He may have a different disability or the impairment, and the device which you are offering does not support it. So that device will be useless or very limited of functionality to him. So in that particular case, the automation, because again, it is a combination of a software and a hardware. So if you really alter the software, if you can really alter the software, then you can make your device versatile for different applications. So here, because of the automation, you can increase the accessibility, reduce the workload again on health. And one more combination here is the use of robotic rehabilitation devices. So you have seen the cases where the subject are wheelchair bound and they are not able to move without any assistance. So here, with the help of exoskeleton, so exoskeleton, I'll explain what exoskeleton in my coming slides also, but just to make create a background here. Exoskeletons are the device. Exoskeleton means an external skeleton which is attached to a body, and then it is providing the required functionality. So this is a robotic device which is being aimed to provide rehabilitation. And there are specialized software and different function which can be based on your disability or impairment like stroke or spinal cord injury or other neurological conditions. So again, we discussed telemedicine. In the similar way, there is a concept which is evolving, which is nowadays called telerehabilitation. So the subject is sitting in their home environments, and the special educators or physiotherapist or uh, mm, uh, the allied clinicians, they are providing the therapy exercises in their home scenarios. And there are some sensors like IMUs or some variables which senses the patient condition and share the information in real time to the educator or the clinician. And then this data can be seen in for the patient performance. It can see that whether the patient is really able to do that or he's compensating that particular movement. And again, the uh, good advantage here is because if you try to see these rehabilitation scenarios, they are really long, like maybe a stroke rehabilitation can long up to 1 year. So taking your subject or the patient to clinic daily for 1 year, it's a really difficult processes for the patient and for the caregivers also. So it helps and increases the patient access and the compliance to that particular treatment or rehabilitation. One more application in which CSIO is working in very good sense is use of virtual reality. So virtual reality, as you have by yourself also have played different games, I'll say here, or seen different VR videos and try to analyze or observe the scenarios where you have not been to. Like if you want to analyze a scenario of like Himalayas, so there are videos, but VR videos. You just need to wear the VR goggles, and then you can feel the how the Himalayas actually this thing. So we have tried to use the same concept that what are the different VR environments by which the patient engagement can be higher and they can be more interactively engaged in the rehab exercises. So the advantage here is it provides the real-time feedback, adaptation to personalized therapy and intensities, because every, as I told you, that every physically impaired individual is different and they require different kind of support. One more application which we are again doing here is the use of AI on rehabilitation data, because it will help to detect the compensatory behaviors. Compensatory behavior here means the subject is not able to do the intended movement and he's trying to compensate the movement by doing some other movement which is not required or which may have an adverse effect on the treatment modality. So those compensatory movement need to identify and they need to be restricted. The movement, evaluate the motor movements or the improvement, the patient recovery is again a part of this. So these are few examples. So the one example as, so this is a linear accelerator machine. CSIO has developed this machine again in collaboration with PGI-MER as a hospital partner and Society for Microwave Research. It's called it's in Samir, Mumbai. So we have worked on this device, this machine, and this machine is basically required for the treatment of cancer patients. So this gives the radiotherapy to these patients, and there are different energy associated. So this earlier we worked on 4 MeV, and later on we switched it to 6 MeV machines. So nowadays 6 MeV machines are being developed. So we were the first to develop this technology, and now there is a company in Bangalore which has taken the know-how from us, and they are developing this. So in this sense, you can see that how a medical device is being developed. validated on patients, and then being transferred to the country local industry for like mass manufacturing or commercialization. So this particular device has, as you are seeing the structure, I am talking of an image which says medical lineage here, and hope you are able to see my cursor also. Anyone can confirm, so I can just check whether you are still engaged with me or no. Madam Aarti, Dr.
Hello.
Apur, yeah, yeah. So,
Yes, sir.
yeah, good morning. So you able to see the
Good
slide
morning.
on which I am?
Sir, first slide is medical lineage.
Yeah,
First
yeah. The first
picture.
slide, the first picture is medical line. Fine. So I'm just saying that here the machine is required. It's a big mechanical structure, and this structure is called gantry, and the on which the patient lies down. This is called the patient couch. So there are different movement associated with, because you need to like really target the tumor in an a dimension of like say 20 centimeter by 20 centimeter. So this, and there are some collimators also. So this whole development has been done by CSIO. So mostly the mechatronic arrangement, the movement of mechanical structure and controlling electronically is done by CSIO. The X-ray or the energy part has been done by Samir, and the clinical requirement part has been done by PGI-MER. And this machine has lasted for 15 years. Like the machine was installed in PGI, and it like really served the patient for 15 years. Again, thanks to PGI for their support in this. Later on, because what are the treatment we are giving to the patient, we need to check the treatment accuracy, whether this machine is able to do it or not. Earlier, we were using the static dosimetry concept. There are dosimeter and which calibrates the machine, and later on we assumes that the treatment is happening. But with the new technology emerging, there is another attachment, the this blue one with a robotic arm, and which is called the electronic portal imaging device. So this device basically captures the image, the beam which has been fallen on the tumor, and it really passed to the body, and this device captures that particular image and then gives the difference between the treatment, what is the plant treatment and what is the delivered treatment. So based on that, you can really correct the further course of action. As I was mentioning of exoskeleton device, so this is a very basic picture where we have just shown the concept. So exoskeleton is a mechanical frame which requires different electrical actuators. So in this case, we have used electrical actuators. They are linear actuators with a DC motor. And there is an associated electronics to control this whole device. And to provide the power, we have used the battery. So these are few examples on which CSIO has worked and transferred these technology to the industry. So till now, like if you just see that what are the different components. So as I have said that you need to have a mechanical structure, and to sense that what the mechanical structure is doing, you require sensors. So the sensors can be position sensors. Those sensors can be sensing the speed or this. So what are the smart sensors then? There is this term is now being used for many years now. So the sensors which generate some sort of decision or which generate some sort of analysis on the site, on the fly, they are smart sensors. They can be called as smart sensors. So they are networked sensors. The sensor is talking to another, one sensor is talking to another sensor. They are again, the power requirements are very low, so they can work very long. Their data transfer rates are very high. Because if the data transfer rates are slow, then you'll have a lag in the sensing, lag will be there, and you will not have a situation in real time monitored. And of course, there is also a requirement of privacy protection. So the data which are being given by these sensors, because it may have patient information as well. So the sensor, these needs to be encrypted and the privacy protection has to happen on these sensors. So if you have developed a mechanical structure, put in some sensors to it, then you require an actuators. So these are again the final control element which provides the required movement. If you want to move a robotic arm, if you want to move a wheelchair, so you require actuators. So there are different type of actuators. Conventionally, we have seen pneumatic actuators, hydraulic actuators, and electrical actuators. So you have seen these actuators mostly in industrial scenarios. You have seen these actuators in field in use. But now, because in medical, you require small actuators, the control needs to be very, very fine because the control with pneumatic and hydraulic actuators are little tricky and you require different approach. So for that only, the advancement is now people are working on series elastic actuators. So they are small actuators, they are force control, and the force control is transferred to a position control. Shape memory alloys are again a new type of actuators where the different combination of different elements like copper, aluminum, or NITI, it's called nickel titanium actuators. So they are being used in medical scenarios and they have a very good applications, this thing. And another advancement is called nano actuators. So once your structure is ready, you have sensors and actuators, they are well planned, but you require a controller, which is like hosting your software, which will like communicate to different sensors, gather their data, generate some decision, and then give those decisions to your actuator. So to make a complete closed loop control, you require a good reconfigurable controller. Reconfigurable means the same hardware can be used for different applications, and you with the change of software, you can really enhance the capabilities. There are different communication protocols because every sensor talks in their own proprietary language. So some sensors are called SPI interfaced, or some are RS2. Most of the industrial controllers like really talk in the older fashion. And because when the data bandwidth requirement is high, so then they talk on the Ethernet communication protocols also. So, and when you talk of a real-time control applications, so the controller needs to be divided into two, the controller hardware needs to be divided into two sections or subsections, I'll say here is. The one is the area on which the control software resides. So that is called the RTOS. And the another one is called the FPGA or the scan section, where it is just uh, like communicating to your um, sensors and actuators and gathering data and having that particular data. But the part of the controller which is like taking the decisions, the RTOS, it needs to be very fast and generate the real-time decisions to it. Okay, now when you say that you have developed the mechanical structure, interface, the sensors, actuators, and you are controlling that particular mechanical arrangement, which we call as now as a robot, to solve some problem, like just like to give some assistance to some individual. But because in this scenario, the robot or your mechanical structure is like interacting with an human, which is a subject, which is a patient in this particular case, then you need to understand this concept of human robot interface and its criticality, because here the environment is dynamically changing. Your subject may make a move which you really not take into understand. The environment is highly uncertain. Some real-time action is required. So you have to identify what is the safe volume or safe contour to that particular robot or your arrangement to work on. And of course, because of this, it increases complexity. So what I'll conclude here is it is very easier to make a industrial robot, but it is very challenging to make a robot which serves a patient or a medical robot. Okay, and enough talk on this, so I'll not go in this. So this is about exoskeleton. I'll just run a very small video here. I see, yeah, it's working. Uh, so it's again taken from web. It is although again a very old video, like some 7, 8 years old video, where the patient is like wheelchair bound. And because of yeah. So till now, what I was discussing, you can just see a live medical device example for this. So this is an exoskeleton suit. So the subject here is a wheelchair bound because of some injury, and she's not able to really take care of his own weight and propel in, which we call as a gait. So there is an external mechanism which is being developed. Now, if you see the other side of images, so this is an external wear mechanism. It is an active because it is giving power to the user. The prime requirement is provide support, and it augments the effort of the individual to make the walk or the progression. So till now, what you have seen, you require a mechanical structure, you require different sensors. So if you just see the image on the right hand side of the slide, so this is a robot developed in Japan. It's basically a suit, and here the purpose is not medical. The purpose is an industrial application. So how a subject can lift more weight or do a more heavy load carrying capabilities, you know, and without getting fatigued or like without getting injured. So they have like really started using those type of robots in their industrial settings. So as I have told that you require a controller, you require a battery, you require different actuators, and you require different sensors. So there are two sensors. One is the FRP sensor, force resistive sensors, to identify the connect with the ground. And there are some sensors, potentiometers, which gives you the range of motion. And because it's a full body suit, so you'll have some sensors for the upper limb and some sensors for the lower limb also. And there are some other sensors which are called EMG sensor, electromyograph sensor, which are bioelectrical sensors, which senses that whether the subject is getting fatigued or not. So again, this is another advanced application where sensors can be installed or like attached, embedded. I'll not so embedded because attached to the patient body because they are surface sensors. And those surface sensors are really like having the patient situation, understanding the patient situation, and that particular information is being used by the controller. So this is very important in medical robots to understand your subject's condition in real time in an every move. Like if you want to make any small robot just to make an movement of wrist, but still you require some sensor which senses whether the patient is feeling okay or not, because it may happen sometime that your subject is not able to provide you the required feedback, and then you have to analyze the patient condition. So again, these are different bioelectrical sensors which is again EMG and other. There are other some sensors also which gives you these. So till now, like I have covered the different applications. If you have any thought on it, if you have any questions, because what I want that the participants in this workshop, they need to understand that how a medical device can be developed, because as a researcher you are already working in this domain and trying to develop some medical technologies, some medical prototypes. So if you have any questions or some examples which you want to discuss, I'll be happy to take it. If you want to discuss what you are developing and like, because till now what I have covered in very basic sense how a robotic medical device can be developed. What are the different components to it? What are the different modalities by which you can use the automation in healthcare? Although I have few more slides, I can go on that. It's fine with me, but I want to hear from the audience.
Participants, we can discuss anything if you want to discuss regarding the biomedical instrumentation or biomedical imaging, or if you are working on in any area, we can discuss that one. Please feel free to discuss the relevant thing.
Yeah,
Or you can
anyone
consider
working
it.
on medical robot or like doing some robotic applications? Any participants? Okay, anyone using X-ray images and using some developing some tailor-made software? Okay, okay. Yeah, Amit. How are you, Amit?
Fine, sir.
Okay, good.
Sir, I'm using X-ray imaging software, and I'm doing all kind of industrial application, industrial baggage scanning, all those things.
Okay,
Now,
so you are
recently,
doing, yeah,
yeah,
please go ahead.
yes, sir. Recently, I just started working on CT images.
Okay,
And CT images, that too also industrial CT images.
okay,
I just trying to expand my knowledge in medical X-ray and medical CT also, sir. That's what I'm trying now.
okay.
Yeah,
Yeah, it
some
is
of
very,
the concepts in medical line, I'm trying to apply in industrial systems, because medical they are at least exposing a lot of things. Whereas in industrial, nothing is highlighted. They are all like capsulated. So this is medical or medical physics, medical imaging, medical CT, whatever I'm learning here, I'm trying to implement in industrial package and industrial CT.
very good, very good. No, in fact, the purpose of like having this interaction is because, as you said, that you are working on the software capabilities, but you see sometimes still the hardware is like, if you just alter the little software modalities or the software functionalities, you can use the same hardware for different applications. Like as
Yes,
you
sir.
are
Yes.
saying that. So that
Yes,
is
sir.
the
Yes, sir.
purpose of this whole workshop, and because CSIO is like having his footprint in medical devices. So we want that the country should also accelerate the medical device
Definitely.
development.
Definitely, sir.
Yes,
Definitely, sir.
yes,
Definitely, sir.
yes. Yeah. We'll be
Thank you.
happy
Thanks.
to collaborate. Yeah.
Yeah. Yeah. Definitely, sir.
Thank you.
Definitely.
Thank you. Yeah.
Thank you, sir.
There is another message I have in the chat box. Sorry. So I'm using the handwriting modality and building a model to detect a Parkinson disease. Oh, wow, very connected. Madam, would you like to share what are the, if you can like use your mic and say that how you are detecting the handwriting modality? It is through image or like using some pen, some pen you are using? How you are doing developing a model set to this?
Sir, actually
Shireen,
already,
yeah,
yeah, good afternoon, sir. Sir, actually already existing data sets are there for the handwriting modality of Parkinson's patients,
okay,
like hand PD, new hand PD. Yeah, so there are various data sets. So using them, I'll be doing it. And in that, actually, they have basically you means the patients have written and those images are there. And using those images, we have extracted the features and then we have analyzed them to identify whether a person is having the disease or not.
okay, okay, yeah. No, in fact, we have also some work in Parkinson. Just one thought I want to share with all the audience here, all the participants. But when you try to work in the medical domain, you try to have a data set which is available and which is a foreign data set, like the data set of the foreign ethnicity population. So try to have your small data set of your own Indian population also, and then you can have a comparison also that the model which you have developed for a foreign data set, it works effectively well to your Indian data set or not. So this is again why I am saying this is because we work in the area of biomechanics, and the model which we are using are being Western model. They are European model mostly, and those model when we try to extrapolate those models on Indian athlete or Indian subjects in that particular scenario, then there the errors is little high. So in similar fashion, I'll also say that you can try to maybe develop a small model set to detect your like to of an Indian population. So this is my submission here.
Yeah. Thank you so much, sir, for your suggestion.
Yeah, thank you. Okay. So any other person who is working in the medical look, the one purpose of like having this workshop is to again create a network of the similar researchers working in a similar domain as Mr. Anand Narayan has said that he's working in the CT images and X-ray images, and Dr. Abhishek is like an expert in this particular area, and maybe there are some other researchers also which are working in this particular domain. So you can have a small working group and then try to have different applications. So the development will be a little faster. Fine.
Sir, I
Yeah.
also have another objective for my research.
Yes.
I am working on the emotional intelligence of the Parkinson's patients. So for that, I am creating a data set.
Oh, very nice. In fact, we have worked on FOG prediction and generating the different cues set for Parkinson in FOG cases. This is one approach, but yes, and you are like, what scale you are using here, UDPRS or some other scale?
No, sir, I am not identifying the stages of Parkinson's. In the case of emotional intelligence, I'm just trying to identify the kind of emotions they feel and like how can we help them and the caretakers, to help them emote better. Because for them, emoting is also a problem. Their facial muscles will be restricted. They are not able to, express themselves clearly, and sometimes they'll be pessimistic and all that. So this is just effort to try to understand what kind of emotions do they feel, and then maybe we can go on further with how we can help them with it.
Very nice, very nice, very nice. All the best to your research. Yeah.
Thank you so much, sir.
So thank you very much, Anna. So Dr. Abhishek, actually I have some other visitor who is waiting. So will it be okay if I just leave here?
Yeah, yes, sir. Yes, sir. Sir.
Okay.
So,
Yeah.
on behalf of all the participants, I just want to thank you to Dr. Neelesh Kumar. He has delivered a very broad picture of biomedical instrumentation. He has explained many terminology and many areas of the umbrella of biomedical instrumentation. So we thank you. Thank you, sir. Thank you for delivering a lecture. Thank you,
Yeah.
sir.
Thank you very much. Bye-bye.
So now, participants, we have a little amount of time. So can we have a short networking type of introduction so everyone can say can turn on the camera and can say the name and the department or the affiliation, and can say what they are working or anything they want to share or regarding any area.
Yeah. Yeah.
Yeah.
No,
Please,
so
sir.
Dr. Saab, this is Sukumar Devnath from CSIR-CFTRI, Mysore. I am handling mainly just working on food process engineering and some machine development, something like that, pertaining to the food processing. So it will help me to design and all these things, put some robots, robotic actions and all these things. So thank you very much. And I'm very happy to be a part of this program. Thank you, sir.
Thank you,
Thank
sir.
you for
Thank
giving this opportunity.
Thank you, sir.
Sir, my name Anantanarayanan K. Working as a Senior Technical Officer 3 at CSIR-CSIO Chennai Center. Mainly working on industrial baggage scanning system, X-ray baggage scanning system, and recently I'm working on industrial CT imaging, and I am also working on medical CT images for reconstruction of medical CT images using deep learning algorithm. So mostly my work is on X-ray, and now I think industrial CT and micro CT also I'm trying to work. So yeah.
Okay. Thank you.
Yes. Thank you. Thank you, sir.
Next.
This workshop is very useful, sir. We are getting lot of highlights in medical signal and image processing. We are covering both basics, advanced, and all the overall view. It was very nice, sir.
Thank you, sir.
Thank you, sir. Thank you, sir. Thank you, sir.
So other participants may also introduce. So the idea of introduction of themselves is like to make a networking so that other participants may be aware like who is attending at the same time, and if any problem, any suggestion or anything is there, we can discuss it. And we have made a WhatsApp group also. We can discuss on the WhatsApp group also. So those kind of things is there. Yeah, please, Shireen.
Yeah, good afternoon, everyone. I am Shireen Zadu, and I am a research scholar from Central University of Jammu.
Okay.
Good afternoon, everybody.
Yeah, good
I am
afternoon.
Dr. Apurvi Sood I'm an assistant professor in Netaji Subhash University of Technology, Dwarka, New Delhi. And the sessions are really nice and they're very informative, since my area of PhD was also uh, deep neural networks, activation functions in deep neural networks. So, and I'm gaining a lot of knowledge. So thank you so much for these sessions, sir.
Thank you. Thank you.
Good afternoon, everyone. I'm Dr. Harnan, and I'm Assistant Professor at Central University of Jammu, Computer Science Engineering Department. And my expertise is NLP. So my PhD thesis was on depression prediction using text data. And also I'm expert in like LLMs, generative AI. Thank you.
Thank you, Arnab. Next participant, anyone? Any other participants? If they are available over here. Mr. Amit Kumar, Mr. Amit R. Chavan.
Good afternoon, everyone.
Hello, am I audible? Okay,
Yeah.
okay, wait. Okay, shall I speak?
Yeah, please, please.
Just a minute, I guess I have some camera issues. Good afternoon, everyone. I'm Amit. I am working as a technology expert in Geetham University. So, previously I worked on biomedical thermal image processing as a junior research fellow in CSIR-CSIO Chandigarh as well. So that's why from then I have interest in working in biomedical thermal image processing. So obviously, yeah, and right now I'm working in some electronic instrumentation regarding that. So it's really helpful to attend this workshop. So thank you, everyone. Okay.
Thank you. Thank you. Next, some participant was saying something before Mr. Amit Chavan.
Hello, good afternoon, everyone. I am Sahurti from CSIR-CSIO Jammu. Currently, I'm working on drug discovery against UTI pathogens. And for the workshop, I'm really finding it very insightful. And the Python practical sessions were really nice. Ma'am taught from the scratch, and they were very clear, sorted lectures. And the files they have shared, they are very insightful. Thank you.
Thank you,
Thank you,
Saurati.
sir.
Thank you. Anyone else? They want to share their area or what they are working, or like what are the like any project they want to discuss? Because like this you can use this platform as a publicity, or as a like saying like I am working on this, or you can discuss your problem or anything. Participant hardly gets the chance to say about their thoughts. So this is an opportunity. Okay, so if the participants are not introducing, then we will take the remaining in the valedictory session, or at the end, or whenever we get time. So now we are getting the lunch time. So we'll close this session now, and we'll get back at 2 o'clock. For 2 o'clock, there will be a practical session that will be conducted by Mr. Abhishek Lodha from Qantas X Acolyte Bangalore Private Limited. He is a senior director. He will explain some AI-based application, and he has also shared one link which you can read and can do what can be the what can be the installation or anything. However, he will explain that one. Like he shared that one, so I thought you may be aware about it. So please be on time at 2 o'clock. We will start the session at 2 o'clock. Thank you. Thank you very much.